A conservative super PAC has been hard at work trying to label Tammy Baldwin as, quote, too liberal for the U.S. Senate. Their latest ad takes on her record on health care, and political reporter Jessica Arp examines their claims in tonight's reality check.
Crossroads GPS, a super PAC headed by former Bush advisor Karl Rove, has been spending much of its unlimited campaign donations attacking Congresswoman Tammy Baldwin.
I actually was for a government takeover of medicine.
Tammy Baldwin pushed an extreme takeover of your health care.
This needs clarification. Baldwin did support a health care bill in 2009 called the United States National Health Care Act that would have provided all Americans with free health care. The plan was what many call a single-payer system, where medical care is decided by patient and doctor, but completely paid for by the government.
It would go beyond Obamacare to create a government-controlled health system, paid for by crushing new taxes on the middle class.
The tax argument is misleading. The bill outlined that the program would be paid for in 4 ways: from existing sources of health care revenue like Medicare and Medicaid, increasing income taxes on the top 5% of income earners, creating a new tax on payroll and self-employment income that would be based on how much someone made, and starting a tax on stock and bond transactions. The bill never outlined how much those taxes would be, nor did the Congressional Budget Office ever take a look. Arguably, the payroll taxes would go up for middle-class families, but the sponsors of the bill argued that it would be offset by the fact that families would no longer have to pay premiums for health care or out-of-pocket costs.
Tammy's plan would outlaw the private health insurance that families depend on.
This is also misleading. The bill would not outlaw insurance companies, but would essentially make private insurance unnecessary. The government would provide and pay for all health care under this plan, replacing whatever private insurance a family currently had. Private insurance companies could provide supplemental coverage for benefits that are not medically necessary, such as cosmetic surgery. Ultimately, this bill died in committee, but would Congresswoman Baldwin support this type of plan in the future? A spokesman for her campaign would only say she would work to fully implement the president's health care law. I'm Jessica Arp with this News 3 Reality Check.